Hi, this is Dr. Jenny Byrne. Today I want to take a couple minutes and answer a question that I get frequently, especially with my coaching clients who are physicians or other professionals. So the question I get is this. They ask me, what can I do to set boundaries and why is it so difficult? So here's, in short, three things that I have discovered in working with others and being a CEO and a physician myself. So, three things. First of all, in my work as a therapist, I have learned that people crave boundaries. They may not say that. So, for example, if you're a physician working with a patient, they may want to send you messages on a Saturday and expect you to get back to them right away. If you're a CEO or an executive, similarly, you might get a weekend message and feel like you have to respond immediately. But you know in your heart that that's not a good boundary for you, that you need to have that Saturday to rest and recharge. So, what I've discovered over the years is that while the person may seem like they want that response immediately, they actually benefit from the boundary. And the key is to setting the expectation about the boundary and explaining why the boundary is so important. So, if you need to rest and recharge on a Saturday, saying that, hey, to show up and be the best version of myself on Monday for you, I need to have the weekend to unplug. That's why I am not going to respond to your messages over the weekend. Explaining the why behind the boundary will actually typically reassure the patient or the person you're working with. So that's number one. Number two is that as a leader or as a physician, people are watching you. So you may not know this, or maybe you know it all too well, but people are scrutinizing your behavior, whether consciously or subconsciously. So when you don't have a boundary, so for example, the Saturday message, and you respond back, people notice that. And what that tells them at a conscious or unconscious level is that they are also expected to check their messages on Saturday and respond back. In other words, whatever behavior you are modeling for them, they will assume that they are expected to do the same thing. When in fact, you probably don't want them messaging on a Saturday. You want them to rest too. And you probably don't want to get those messages on a Saturday, so you don't want them sending them to you. So you're modeling whether you know it or not. And then finally, if you do not set boundaries, one of the consequences is you have very little mental space or energy to do the work that will help sustain you to succeed professionally. So, for example, if all you're doing is responding immediately to messages on email, even during the week, and you're not carving time for yourself as a business person to work on your business instead of in your business will suffer. And I have learned this lesson myself very painfully. If you're a physician and you don't create time and space for you to continue to learn and grow and take care of yourself, you will not show up as the best healer that you can. If you don't really take time to continue to learn, you're not serving your patients. If you show up with a bad energy because you're not taking care of yourself, you're actually not helping your patients as much as you think you are. So I think sometimes reframing boundaries around these three things, that people actually need and crave boundaries, that you are modeling this behavior, and that if you don't create the mental space, you're actually not going to do as good of a job as you could. Hope that's helpful. This topic comes up very frequently. Thanks.